Hot topics, key areas, key concepts. Well, what are the key issues we've come across this year? Well, I suppose on a year-to-year basis, hot topics, key issues will change, understandably. And it's very important that we follow these key areas or hot topics on a regular basis. So how do you do that? You know, you've got your interviews coming up perhaps. You're in year 12, year 13. How do you keep abreast of what are the current developments? What are the key issues? What are the hot topics? Well, what I advise my students to do is do some regular reading. These days, with information being so handy, all right, everything coming to your phone, well, why don't you subscribe to RSS feeds, which means things are coming to you, information is coming to you. Why don't you go to the BBC website and follow the health section, the social section, the welfare section? Why don't you follow Google in a similar way, Google News? That way you will be abreast of key issues that are going on in the UK and abroad on a day-to-day basis. And I advise you to perhaps, do about an hour's worth of, reading and browsing in the weekend, perhaps, starting from year 12. And that way you'll find that come preparation for the MMI interviews, for the panel interviews, you'll be a lot more abreast of these issues. Okay, so that's my advice in terms of staying on top of it all. What have we seen so far? Well, I mean, as you know, year on year things change. There are certain evergreen topics which are always there. For example, abortion, pro-life, pro-choice, that kind of thing. It will always be evergreen. Rationing, so, say transplants and how do you give to someone and not give to someone else. These kind of issues will always, in my opinion, creep up. At the moment, what's hot is, and it's part of an evergreen topic as well, it is the issue of euthanasia. In the UK, as you know, it's a big discussion in Parliament about whether we allow assisted dying or not. As you know, the bill has passed and it's a matter of deciding on how to execute the law so that it's operationalised in the NHS. So I think that will be important to know about in the next few years. But we'll always come across other hot topics out there, whether you're an aspiring medic or an aspiring dentist. The NHS, if you look at challenges and reforms, this year we have seen the new government putting a big emphasis on the workforce and addressing the workforce crisis. So whether that means more consultants needed, more GPs needed, more junior doctors needed, more dentists needed within NHS dentistry, all of this is an ongoing issue. The junior doctors strike has concluded, the consultant strike concluded, but the dentists' pay review and potential strike is on the books. The GP strike is an ongoing issue. So you need to be able to understand and navigate these issues, and questions can and will come up around how that impacts on delivery of care, how that impacts on patient safety, how that impacts on certain groups of patients, such as deprived communities, such as refugee communities, such as immigrant communities, such as elderly patients. We also came across the long-term NHS workforce plan not so long ago, and that talked about provision for dentistry and provision for primary and secondary care. Have you had a read about that? There may be questions around that issue as well. On the back of it, there's always been the issue of the NHS funding. Should we privatise certain parts of the NHS? Should we privatise all of it? Are there any alternative versions that we can adopt, like they have in Canada, Australia, Europe, or even in the US? So how does funding constraints affect the NHS in how it delivers care? You've got the winter crisis. That's a perennial repetitive issue. Every winter we see this. And how does that affect access? How does that affect patient care? How does that affect patient death, mortality, and so forth? we are seeing in all of this the introduction of tech, the introduction of digital healthcare. How does that affect people in delivering care? How does it affect those segments of cohorts, the population cohorts that I mentioned earlier on, whether you're elderly, whether you're non-English speaking, whether you're an immigrant population. What about the NHS efficiency issues? We're constantly looking at how do we improve efficiency within the NHS. How are we going to work better? How are we going to deliver services better? There's also been the public health concerns around mental health issues. So mental health around young people, young men, and the elderly population. How do we address that? Obesity has been a big thing, especially around medication availability, such as Mounjaro, such as Ozempic. Availability to certain people and not available to other people. It's worth doing some reading around that. Antibiotic resistance, that's been around for several years. I've seen questions coming up around that over the last few years. What does it mean for the population in the UK? From a local point of view, from a global perspective as well, antibiotic and antimicrobial resistance has been a big issue that I think is worth reading about, really. Health inequalities has been a massive agenda on the government's book. In fact, that's been one of the reasons for looking into NHS reform, because the evidence is that the hard-to-reach communities, or rather, as I'd like to call it, the hardly reached communities are not accessing or can't access healthcare the way other communities can. So accessing the NHS in different ways. How also implementation of efficiencies and digital tech is potentially widening gap rather than improving in certain communities. The look at diversion and inclusion within the NHS, as you might have come across the diversity and inclusion officers within NHS trusts, as a role. How is that potentially improving diversity and inclusion within the NHS? Is it getting better for people coming from certain communities? As I mentioned to you earlier on about digital and tech and apps and so forth, which are helping patients and clinicians alike, equally, are there any risks associated with it? Especially with AI. AI is playing a big role in the NHS already, whether it's interpretation of scans, whether it's helping in diagnosis and management. This, I think, is going to continue. This, I think, is going to continue to increase. Certainly in your career, when you become doctors and dentists, you'll be having that extra member of staff almost within your multidisciplinary teams. This person who isn't a real live person but is digital, is technology, whether they're in robot form, whether it's a screen next to you in your meeting room. I think there will be this extra player who'll play a bigger part in your careers in the care of your patients. From an ethical perspective, I've already mentioned assisted dying, but perhaps you should also think about how it will impact on decision making around consent and capacity. Will that change in terms of giving life-saving treatment and so forth, with how the boundaries of ethics, AI, digital, etc. is changing? Data as well. We've heard reports of data loss and data leakage and so forth. With the advent of cloud storage and looking after data in different ways, and also access both locally and internationally by perhaps insurance company, perhaps by healthcare companies. What are the pros and cons around that? And it's worth considering that as well. I haven't seen so many COVID questions last year, and I doubt we'll see so many in that regards. But what we are seeing is questions around the post-pandemic recovery, around long COVID, around treatment backlogs. So loads of people waiting for surgery. People can't access GPs, consultants and dentists. The flailing vaccination campaigns, the anti-vaxxing movement and so forth. How do we manage that? How does that affect people? How does that affect healthcare in general? And what about spillover issues? For example, on the back of vaccine hesitancy around COVID vaccination, we've seen a decline in uptake of flu vaccination and childhood vaccinations. And we've seen the uptick of measles, mumps, rubella in the UK. How does that affect herd immunity? How does that affect nurseries, schools, universities, and so forth? How does it affect other people, other cohorts like our elderly population in our communities? We've also had the environment issue as a big thing. So the NHS also has net zero goals. How can GP surgeries, dental surgeries, hospitals work towards net zero in terms of staff, patients, the facilities? How can all of those appendages around the NHS contribute towards net zero? What about the impact of on the climate? So simple things like inhalers, would you believe, has a massive impact on greenhouse gases around the world. It's massive. So these are just a few areas that I could think about. There's probably more. Can you think about any more? If so, drop us a line and let us know. We'll have a look at them. If you want me to discuss like other key topics, perhaps as specific video that we can upload for you, again, feel free to ask. We can but oblige. Thanks for listening. See you around.